Assalamu alaikum, learned audience. I am Dr. Nilufar Fatema, Consultant Department of Cardiology, Bangabandhu Sheikh Mujib Medical University. I'm going to present my case, a pulseless young patient. He is a 34 years male, headache for 4 years, dizziness and vertigo and pleuritic chest pain. And this pain radiates both hand. And on pulse examination, both brachial and radial pulses are absent, and bilateral popliteal and arterial dorsalis predis are present. And ankle blood pressure was measured, and it is 160 by 95 millimeter of mercury, and there is bilateral carotid bruit. In investigation, there is ESR and CRP both are raised, and ECG shows LVH, and echo shows no regional wall motion abnormality, mild LV concentric hypertrophy, good LV systolic function, ejection fraction 65, and tissue Doppler imaging shows grade 1 diastolic dysfunction of LV and mild pericardial effusion. This is his ECG. LVH present, and 2D echo shows a dilated LA, and LVH and good LV systolic function with mild pericardial effusion. TDI showed diastolic dysfunction. Next, we did the carotid duplex study. And here you can see in the left panel, it is a atherosclerotic change in carotid Doppler, where you see the intima-medial thickness is slightly increased, and it is eccentric in anterior wall thickening. In the figure B shows my case, which is the increased intima-medial thickness in whole length, and this is called the macaroni sign. And you can appreciate here in colored flow of in right coronary common carotid artery, and you can see the macaroni sign, that whole thickness of intima-medial thickness is increased in whole length of this common carotid artery. And you can appreciate here in figure A, it is an eccentric anterior plug in a atherosclerotic old patient. And in my case, figure B, you can appreciate there is no plaque, but the whole intima-medial thickness is thickened. So what is macaroni sign? It is a typically occurs in Takayasu Arteritis. It represents the smooth, homogeneous, moderately echogenic circumferential thickening of arterial wall. And it is the pathognomic ultrasonographic sign in this disease. Here is the reference. And when we did duplex, and there is peak systolic and end diastolic, both velocities are increased. Next, we did the CT aortography and its branches to confirm the case. And you can appreciate here, there is a absent left subclavian artery, and right subclavian artery is there, but when it became axillary artery, it became absent. And there is significant narrowing in both common carotid artery. And you can also appreciate here the bilateral renal and common iliac artery, and narrowing can be happen also in Takayasu Arteritis. Takayasu Arteritis, it is a granulomatous vasculitis affecting the aorta and its branches, and onset is before 50 years of age, and chronic vascular inflammation leads to adventitial thickening. And intima-medial thickness, medial hyperplasia due to the cellular infiltration. And chronic and persistent inflammation leads to the fibrosis of the medium and intima, and resulting the narrowing of this artery. These are the reference. And other modality, we can do the conventional aortography, MR aortography, and PET scan. It can measure the intensity of the inflammation in vessel. Future for this group of patients is immune study and genetic study. And treatment options are corticosteroid to control the inflammation, immune suppressive drug, methotrexate and azathioprine can be used, and biologics also can be considered, with research are going on. And there is percutaneous angioplasty we can do, and also surgical option, that is bypass surgery. So the take-home message is carotid ultrasonography is the best non-invasive modality of the vessel wall assessment in case of Takayasu Arteritis. And angiography is confirmatory test in this disease, and it can show the luminal narrowing and extent of the involvement. And macaroni sign is the pathognomic ultrasonographic sign in Takayasu Arteritis. So when we get macaroni sign, then we can we will get the clue that we are dealing with a Takayasu Arteritis disease. And duplex study can also be done to see the treatment response. Thank you all for